we are very grateful to the Azim Premji Foundation who have partnered with us. Their relationship with us started, I think 4 or 5 years ago when COVID struck, and since then our relationship has only gone stronger, and we are very grateful for their support, and we value the trust that they have placed on us.
We have CMC graduates running these hospitals. So you go to the remotest corners of this country, the most difficult places of this country, where nobody wants to go and work for anything. Forget about being a doctor who can earn a few million in Bangalore or even in Hubli. Nobody wants to go to these places. But if you go to these places, and I just listed 4, I don't know, I'm sure you could list 200 places more, right? Yeah. So we could list any number of places where nobody wants to go, but if you go there, you'll find a good hospital, you'll have dedicated nurses also, dedicated doctors, other para-health professionals, and incredible as it might sound, but I don't know, 80%, 90% of them come from CMC. What does it tell us? What it tells us, what it told us as in the Azim Premji Foundation, when during COVID we went around the country trying to figure out how we could help, right? So we went to all these hospitals. What it told us, there's something truly special about this institution. See, all of us know that we are really ill, we have some really complicated problem, Vellore is nearby, we can always go there. CMC is known as an exemplary institution for complex medical issues. We'll all go there, we know that. But AIIMS is also like that. So you have at least 4, 5, 6 institutions in the country which can be counted in the same, on the fingertips. But then what's so special about CMC, because of its graduates, are the only people, or mostly the people that you find in such places. And that's what really hit us, hit the foundation, hit my colleagues, many of them are here, when we went to all these places. And we realized, and then we had the privilege of meeting this team, and of course then working closely together with them, that this institution over the past 124 years has built an ethos and a culture which truly prepares healthcare professionals not just to be the most competent in the country, which it is, but also the most service oriented. Truly, all our dreams of Dr. Kotnis ki Amar Kahani and all that, most of you seem to be too young to remember Dr. Kotnis' Amar Kahani, but all this vision we have of service and doctor, they have truly built an ethos and a culture. And it's not just for the sake of saying it, they have done it over the past 125 years. So, you have expertise, competence of the highest order, and you have dedication and commitment to service to this country, the people of this country, the most vulnerable of the highest order. So, therefore, in our assessment, this is a truly special institution. Unfortunately for this country, there are not so many of these institutions in any sphere, whether it's medicine or agriculture, or you can take any sphere. But this is a truly special institution. So it's our privilege. It's our privilege that CMC has been such an important supporter and collaborator of ours as we have tried to work in health. And of course, it's a privilege to be able to support this new medical college and hospital that CMC is starting in Chittoor.
But in this particular medical college, we want to focus our training on secondary hospital care. So that's a little different, and the objective is to set up a model system that can be replicated across the country in terms of training and sending out people. What this country does not lack is high-end tertiary quaternary care centers in most metros, are as good as anywhere in the world in many places. But what we really lack is good primary and secondary care hospitals where people don't have to come to the metros, and most of their diseases, 95% of illnesses, can be taken care of in the peripheries at low cost, effective care without having to come to tertiary and quaternary centers. The timelines. So this project has actually, we've been working on these timelines for quite some time, and with this grant being available, with the clearances, there's this, we hope to get the clearances all through in the next 6 months. And the next 2.5 years after that, so about 2.5 to 3 years from now, the hospital will be running. For the medical college to happen, this hospital will have to be running for a minimum of 2 years with 60% occupancy before we can go to NMC and get the approvals for a medical college to start using the same resources. And further expansion will go in a phased manner over the next 10 years. But the hospital itself will be up and running in the next 2.5 to 3 years. That's the 422 bed hospital, 425 bed hospital. The second part, do we have plans to start multiple hospitals like this? You're absolutely right. We don't have the resources there. We're constrained by the resources available to us at this point in time. This itself is a major exercise. And our focus is not so much on setting up our hospitals as so much as training personnel to go out and work in already established centers, including district hospitals, etc. There are many resources out there. The biggest constraints in healthcare is personnel and personnel in the appropriate locations.